So just to be clear sort of about this presentation, it's going to be more sort of a short practical introduction to doing qualitative research and a small discussion around mixed methods as well. I'm not going to go into any depth in terms of a discussion about the philosophical or theoretical underpinnings of different research designs. Those can be really fascinating, and I would encourage people to look into them. And I think they can certainly inform how you put together your research, but that's sort of outside of the scope of this particular presentation. If that's something you'd like to hear more about, though, you could always let Bryn know. That would be a different session. So when thinking about, where to start, as with any research, realistically, you're thinking about what's the focus, what is your topic of interest, what's the purpose, what do you want to learn? And in terms of whether or not you should do qualitative research, I think it really does depend on what it is you're actually trying to learn about. As we'll see, I think it plays a big role in terms of whether it is a qualitative research sort of design that you end up with. Is it mixed methods? Because they are answering different questions. And then engage with patients as research team members, particularly within health research. Now, as I'm sure you recall, my colleague Lauren McLaughlin, who works with the MSSU, actually gave an explore session about this topic. So I'm not going to go into that too much, except to say that I think that's a great idea. And I think it's something that you should think about at the beginning, because realistically, your participants, especially in qualitative research, should be informing your research, frankly. And so in healthcare research, that generally would mean engaging with patients, but I think it could be more broadly put as engaging with participants. So what is your topic of interest? Obviously, if you're thinking about qualitative research, it's probably focusing in on groups of people, in which case, can you engage some of those people to, in fact, inform how the research project is put together? Because it will make it more successful, essentially. And I think also remembering to be flexible, that the process of designing research is usually iterative, because it's often based on feasibility, or should be based on feasibility. And as you'll see, especially within qualitative research, it is meant to be truly iterative and reflexive. And therefore, you shouldn't be afraid to sort of tweak things as you go along. That doesn't mean necessarily changing your whole topic, which would, if you've already gotten RAB approval, would mean resubmitting to HRPP. But I think being flexible, especially when you're starting to put ideas together about what is your topic, and then what methods are best going to answer your questions. So in terms of that, obviously, the sort of the same rules apply to qualitative research. There should be a relevant gap in the literature, looking through the literature in terms of what is already out there on your topic of interest, focused enough to be feasible. And this, I think, is extremely important. Time and resources, do you have what is needed in order to actually complete the research project? That's incredibly critical. And with qualitative research in general, it will take quite a bit of time in order to do, and therefore you need to think about that. Now, sometimes in qualitative research, rather than research questions, although you can have research questions, objective statements are often sometimes more appropriate. I've put in here just a few examples. the aim of this study was to characterize challenges facing nursing home staff in receiving and resolving medication discrepancies during resident intake. Another was to explore pharmacists' perspectives and experience in supplying clozapine. So just to give you an idea, that it doesn't necessarily have to be in question format, and I think that reflects sometimes the more broad and exploratory nature of qualitative research. So, when to conduct qualitative, quantitative, or mixed methods research? I mean, realistically, this is a really difficult question to answer sometimes. But just to sort of break it down, for qualitative research in general, you're looking at exploratory research. You're trying to understand participants' experiences and perspectives holistically, which means that you're really emphasizing the context in which these participants live. Whereas in quantitative, you are focused in on causal explanations, precise predictions, you're testing hypotheses. Now you can see there how these can fit together, which we'll explore a bit further on, but you could have a qualitative piece, which is exploratory, and then you follow it up looking at sort of precise predictions that you've put together from the initial qualitative piece. In qualitative, you're usually looking at smaller numbers of participants, so sometimes qualitative is more feasible. Whereas the number of participants for quantitative is really dependent on us, putting together a power analysis, but would generally be larger. And that is because of the third point, which is generalizability. So quantitative, you're trying to essentially make it extremely generalizable, or as much as possible. Whereas in qualitative, it's not necessarily generalizable outside of the narrow participant group. And so this is a critical point. Now, I would say that in qualitative, it can be generalizable depending on, how you're sort of writing up that generalizability, right? Because that participant group might be reflective of other groups elsewhere. Just something to keep in mind. And then in qualitative, it can be used for the generation of theories as well. And then again, we see that, how this can sort of, tie into quantitative, which is really testing of theories. It can generate new ones as well. And so obviously mixed methods, you're using both of those to sort of get at a broader picture, I would say. So I only have one cartoon in here to lighten the mood. So obviously in the quantitative methods, you're counting the ice cream, how many people take the free ice cream, whereas in the qualitative, you're asking them about how they felt about that free ice cream. So just a little more on qualitative research. So really, you're exploring the socially constructed realities of people. And this goes back to sort of the philosophical underpinnings of, different types of research. But essentially, you're focused in on, people's perspectives and lived experiences. You're trying to get at that emic or inside point of view and meanings. And I think that's really important to stress because, this is what the fit is with qualitative research. So if your topic is not looking at these things, then I think you need to rethink whether qualitative is what you should be using. And some examples in health research that I just grabbed, reasons for dropout from cardiac rehabilitation programs in women, a qualitative study, interfacility communication barriers, delay resolving medication discrepancies during transitions of care, community pharmacists' attitudes and opinions towards supplying clozapine. So you can see there, it isn't necessarily patient focused. It's just people focused. So within health research, the focus is often on patients, but it doesn't necessarily have to be so. Obviously, it can be about healthcare professionals. It can be about organizations as well, in terms of the people within organizations, and, you know, sort of what is going on within that in terms of sort of the lived experiences within organizations or working within them. So some common types of qualitative research approaches, and I've only listed sort of the main ones here. There are more than these, obviously, and some of them are quite interesting, so I would suggest exploring further. You have phenomenology, which really is describing the meaning for several individuals of their lived experiences of a concept or a phenomenon. And so phenomenology is very common in health research. You know, you're asking people about their lived experiences, or you're trying to get at sort of how a group is experiencing something. In grounded theory, which is also really common in health research, you're generating theories. So the whole point of that is that, and generally speaking, you're sort of starting out without any preconceived notions, and you're trying to build a theory from the ground up about whatever phenomenon it is that you're studying. And case study, which is really familiar to a lot of people in healthcare, because, you know, obviously you could have a patient case study. And so this is a study of an issue explored through one or more cases within a bounded system, which is a setting or a context. So, you know, the case is a sort of unit unto itself, and you're exploring sort of everything within that. An example would be, I just finished up a project in which we did multiple case studies of seniors transitioning home from the hospital. And so in that case, you collect as much information as possible about sort of their experience of that transition. And the bounded context is that person. And, you know, their transitional experience was the focus. So, and some of the other ones would be ethnography, right, where you're much more getting at sort of a group of people. And it has some other distinctive qualities, but you're looking at sort of a group. And then narrative approaches, which are more focused on individuals, and also sort of paying attention as well to, you can also do narrative analysis as well, which I'm not going to get into, but it's very interesting as well. And so these give you an idea of sort of some of the different ways that you can approach sort of your qualitative research project. So again, you know, are you looking at a bounded case? Are you trying to come up with a theory about why something is happening? Or are you looking at sort of a phenomenon and how different people are experiencing it and seeing whether there's some commonality there? And so obviously, depending on what you choose as sort of your approach, then that informs your data collection methods. So for, say, you know, you can use multiples of these for many of those approaches. But you can see how sometimes some of them lend themselves in particular. So phenomenology interviewing is a great way to sort of explore people's lived experiences. You ask them directly about them and they'll tell you. And so in interviewing, you've got the individual interview, which you're really doing for depth, right? You're asking somebody for sort of in-depth experience, experiential information, about themselves. Focus groups or group interviews, you're sort of trying to focus multiple people onto a particular topic. And I didn't write it down here, but one of the things about focus groups and interviews that you have to think about is, what is your topic? Is it sensitive? Are people less likely to talk about it in a group format? What about, group dynamics as well, right? You need to think through sort of how your topic informs what methods you should be using. If it's something really personal, then obviously you're going to want to use an individual interview. And those could be done in person or over the phone or Skype. We're in the middle of a pandemic, so realistically, most qualitative research is at a standstill, I would suspect. But these times will change, obviously. But there are ways of sort of connecting with people from a distance as well. In person is obviously preferred because what you're looking for there is a rapport between the person giving the interview and the participant. And focus groups, obviously you'd have to pay attention to dynamics, and you have a moderator for a reason in order to try to get sort of everyone participating. And there's different styles to all of those in terms of they can be unstructured. You could just have an objective sort of statement or a topic statement and then let the person lead the discussion from there. That's pretty uncommon. The most common is semi-structured. So you have an interview guide, you have a list of questions about your topic that you would like the person to answer, but you allow for them to carry the conversation where they think it should go as well and explore sort of the avenues that they bring up. And this can be really important, as I mentioned, about sort of the iterative nature of qualitative research, is if your interview guide isn't working, people don't want to talk about what you've put down, then the reality is that you may not be sort of on the right track about what is important to the people who have actually had this experience that you're sort of looking at, or the topic. And you should, because qualitative research is about essentially getting their perspective, then what would happen is you reformulate your interview guide. So often what I would suggest is piloting an interview guide and then reformulating it based on feedback, which you can actually ask for just, directly. And I do put into all of my interview guides asking people directly what they, are there questions that I should be asking that aren't on here? And is there anything that they would like, they would change about it? Because I think that's critical and it's of importance that their feedback, then actually inform the research project, because you are in fact trying to get at their perspective. And a structured interview is really uncommon, and I would suggest not appropriate for the most part, because if it's structured, then is that a survey? Should you then, what are you trying, why aren't you allowing them to lead at least part of the conversation? And I would think about that. Another method that's commonly used is observation. So this can be sort of just, perhaps it's, looking at how nurses on a particular unit work, And so you could have a researcher who goes and observes sort of, where they work in a workstation or something like that, and then take notes. But a lot more common in qualitative research is actually participant observation, where the researcher themselves is in the situation with the participant, but there needs to be a recognition that that is the case. So the researcher is reflexive. You're there, you're interacting, you might be asking questions. We had a research project where a research assistant would go to the home of participants and they might observe sort of what's going on in the house in terms of how people are making out with the transition from hospital. But they're also asking them questions, and there's a recognition that they're there, right? It's not experimental observation, I guess is what I'm saying. Is, there's a different connotation there. And some other data collection methods. So documents, obviously you can do a textual analysis as well. If you're doing case study, then that might include sort of somebody's medical records. Participant diaries are really interesting one. And this would be where you're asking the participant to write down which can be true diary in terms of asking them about their thoughts and feelings about, your topic over time. It can also be, them sort of writing about something in particular. Photography, and this is one that actually has sort of come to the forefront lately. Photography can be the researcher themselves going out and taking photographs of, a research site, or it can be participants asked to take photographs in relation to the topic, and those can be really powerful. This can be true for video as well. Again, it could be the researcher or it could be the participant. And sometimes it can be both, right? Working together collaboratively. And the same with artwork as well, and music, which I didn't put down there. So there can be some really innovative sort of ways of getting people's sort of information, which I would suggest sort of, it's worthwhile sort of digging into, depending on sort of how it relates to your project. Now, the sometimes contentious topic of rigour. I had this titled as rigour and sampling, and then deleted sampling, because sampling is really a quantitative sort of conception, which some people would disagree with that. But I think in general, with your topic, and depending on your approach to the research, you would want to think about who it is you're trying to contact, who your participants are, what is your participant group. And in qualitative research, it's generally purposive, right? Like, so you are purposefully going after a specific group of people. Which is why I sort of didn't include it in here. And in terms of rigour, so in this way, your reflexivity as a researcher needs to sort of be at the forefront, right? You're part of the context of the research that you're doing, so that you need to sort of build that into it, that awareness. Use of multiple methods, right? So, there's all kinds of different kinds of data collection that you can do. And so using multiple forms of it just sort of can be really great in that way. You're getting sort of different perspectives from different pieces of information and people. It's an iterative approach. As I said, you're really being informed by what it is that you're finding. And team analyses. So you're having more than just one person look at what is happening. Although I would say that I think you can have a very rigorous project where there's just one researcher. I think that, again, it goes back to sort of having that iterative approach, being reflexive, and then you're ensuring saturation, which would be a critical part. And so saturation in qualitative research essentially means that you have reached the point where you're finding nothing new, about your topic. You have gotten enough information from enough people that what you're seeing is repetitive, right? Now, there's cases where maybe you never reach that, and I would suggest what's happening there is perhaps it's not focused in enough, and that can happen. But if your research is focused, then what should happen is you start to see repetition in the information that you're gathering. Now, I'm not really going to get into qualitative data analysis too much because it's very dependent on your design and methods. So it needs to be connected to what what your approach is, what design you used, and then what methods you used. I will say that any text from interviews or focus groups is transcribed verbatim, and you're analyzing those. Your analysis is iterative, and this is what helps with the rigor as well, is if you are analyzing your data as it comes in, which in qualitative research is, as opposed to quantitative, is in fact what you should be doing, because what that will do is sort of, number one, you're being iterative in the sense of you're analyzing as you go. You're also changing, if you're finding that, let's say everybody's telling you that you should be asking these questions in interviews, you actually change that, include those questions. And are you starting to see patterns or not? And so that will be helpful. I will say that, so the example I've given is thematic analysis, because that is the most common sort of form of analysis that you'll see, because most of the qualitative data collected will probably be, interviews, focus groups, that kind of thing. And so what you're really doing there, and I'm not getting into it too much, but there's lots of great books that sort of delineate how to code. But essentially, you're looking for participants' meanings, feelings, and actions, sort of meaningful pieces of your data, and similarities, right? So across sort of people or participants, and you're generating these codes from the data itself, although there are code. You can do coding where you have preconceived sort of categories as well, or foci. So again, that's a complicated sort of area that I'll leave for another day. And you can use qualitative data software, such as InVivo or Atlas TI are two big ones. I will say that if you're new to qualitative research, they don't actually analyze anything. So it's really more facilitating sort of storage of your data and ease of organization of your analysis. So I've had some people get excited thinking that the programs would do the analysis themselves, and they do not. Okay, so mixed methods. So we have we've talked a little bit about qualitative research and, what sort of questions it's going to be answering. And so maybe you're thinking, I also want some quantitative pieces in there. Like, there are questions that I have that are better suited to be understood through a quantitative approach. So in that case, you're going to need to be thinking about the timing. So, are these pieces happening at the same time? Are you having sort of, a qualitative project, and then you're going to build your quantitative piece that's informed by that? As we saw, sometimes that can be really powerful, right? If it's exploratory, you come up with a theory and then you test the theory, say, in a quantitative way. Weighting, sometimes the project is focused more on qualitative or quantitative. They can also be equal. The mixing, so in terms of, how and when and are they going to be mixed together, right? Like at some point, if you're doing them, you have to draw them together, and they have to inform one another. And theorizing. So this one is, do you have a theory from the onset, like of the research in total, or is it sort of underlying but not necessarily explicit? Oh, okay. So hopefully these are readable to you guys. And this is from Cresswell, who I find explains mixed methods really quite clearly. And so I'm not going to sort of get into the sort of minutiae of this, but essentially you need to sort of think about how all of these pieces are going to fit together, right? Are you emphasizing, what's your timing? Are they concurrent? Are they not? How are you weighting them equally, one more so than the other? Again, the mixing. So one that I've used often is embedding, where perhaps, you have a larger quantitative study and you want to pull out a subset of people and do a qualitative sort of sub-study with them to try to get some more in-depth answers about your topic. And that can be really great because then these people sort of give you sort of more information that can help sort of inform what is really the sort of main thrust, which is this bigger piece, quantitative piece. And so just to give an example, these can look pretty confusing, but I think once you sort of get into it, and it really depends on your project too, sort of these different kinds of designs, which essentially is sort of laying out those different pieces of timing, weighting, and where your analysis is going to come into play, right? And how they're going to be potentially put together as well. So you might have it sequential, right? You have quantitative data collection, then quantitative analysis, and then, smaller subset or project sort of, related, which is qualitative data collected and then analyzed. And then you're bringing those two pieces together for an analysis of the whole sort of piece. And he's calling that, sequential explanatory design. I think it really depends on sort of what you're looking at. And again, it goes back to like, what do you want answered and how is it best answered? You can look at sort of the concurrent ones, which the one he calls triangulation can be quite interesting because essentially, if you're looking at a topic and you are collecting quantitative data on it and qualitative, you can see whether they're saying sort of the same thing and how they might be differing, which can be really informative. Again, so, you're getting a larger piece over here, probably with more numbers on the quantitative, and a little bit probably more in depth than, sort of people's perspectives in the qualitative. And then I talked about embedded design as well. So you can have that sort of small embedded qualitative piece in a larger quantitative piece. Say you're doing a survey of a particular patient population, and then if they want to, they can sort of say, yes, I'd like to be interviewed. And then you do interviews with them while the survey is ongoing. And they can really it can really add to those quantitative findings. Okay, so that was just my brief overview. Thank you. Questions or comments? And I have a further reading list here, so I'm not sure whether perhaps Bryn can make that available. This is being recorded, so I'll just pause on them and maybe people can look at the recording.